Okay. Welcome. Welcome and good morning. Can you hear me? Yep. Looks like we're going. My name's Dave Kindig, and with George Isham, I co-chair this roundtable on population health improvement. On behalf of our whole roundtable and staff, like to welcome everybody today to this, and actually I should underline our 7th workshop in our life as a roundtable. This workshop titled Health and Education, Working Together for Common Goals. As is our usual practice, this is being recorded and webcast, and we welcome all of those who have joined us on the web, in addition to those who are here in person. This roundtable provides a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities arising from changes in the social and political environment for achieving better population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that such outcomes as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, yes, and healthcare factors, and will require robust national community-based policies and dependable resources to achieve it. As one of its major activities, this roundtable sponsors workshops for members, stakeholders, and the public to discuss issues of importance in improving the nation's health. Our roundtable in our non-public discussions and our planning meetings has identified 6 drivers of that mission and vision, which we believe are key to improving population health, and that are also areas where we can further dialogue and catalyze action. These 6 drivers are metrics, policy, relationships, evidence, resources, and effective communication. Today's workshop clearly cuts across many of these boxes. They don't exist, obviously, in isolation, but particularly touches on the policy, evidence, and relationship drivers. As we will learn today, evidence, education, and health are linked in multiple and complex ways. Healthy People 2020, the health agenda for the nation, identifies high school graduation as one of the leading health indicators based on the solid education evidence that educational attainment is a powerful influence on health outcomes later in life. As you can see from our agenda, today's workshop is intended to, 1, showcase a conversation about what we know about the relationship between education and health and how this can inform our nation's policies and investments, and showcase examples and facilitate a dialogue about how the health and education sectors can work together to achieve co-benefits, i.e. improvements in educational attainment and in health status. The co-benefit point actually grows and builds on our previous workshop last fall in Health and All Policies, and underscores the maxim that social policy is health policy. The keynote presentations, one by Steve Wolf and the other by Peter Orzag, will address the first aim of understanding these relationships. The panel presentations occurring at other points during the day will help address the second aim. The attendee packet available at the registration table includes bios of our speakers and moderators, as well as a resource list. I would particularly like to draw your attention to 2 briefs from the Virginia Commonwealth University Center on Society and Health. These provide an excellent overview of the relationship between health and education, in addition to everything else we're going to learn today. So now I'd like to introduce our roundtable member, Jillian Barclay, who co-chaired the planning committee for this workshop and will provide an overview of the agenda and a brief context to our topic. Jillian is the vice president of the Aetna Foundation and a member of our roundtable. Jillian.